When you're sad and blue and everything is putting you down, you know the world keeps spinning around. You know you're not alone.
Yes, with MS, the world keeps spinning around, but you're not alone. Welcome to the 10 Minutes for MS podcast, in which we share information about MS in just 10 minutes. In this episode, I'm glad to welcome Dr. Ree, physician specialized in stem cell therapy. Hi, Dr. Ree. Welcome to 10 Minutes for MS podcast.
Thank you for having me.
Stem cell therapy is such a topic that everybody wants to know what it is. There isn't much awareness about it. So we need to reach out to people to tell them why someone should offer stem cell therapy. So doctor, if someone does stem cell therapy, are there any kind of side effects related to it?
Yes. So just like with most medications, these are not things that you will expect to have, and a lot of patients don't have them. But you could trigger an important immune response. You could trigger a flare-up of symptoms. You could decrease your quality of life for a certain period of time while your immune system rebalances. Now, there are a lot of things that different clinics, different protocols can do to mitigate these things. It is rather rare when being treated by professionals who are knowledgeable both in stem cells and in multiple sclerosis, but it is a possibility. There is also a possibility of everything, all the risks that are related with the bone marrow aspirate, for instance. So you can get bruises, you can get infection, and you can get a bunch of other things that need to be considered. It's certain cases, it's uncomfortable, so you'll be sore for a couple of days. So those things you need to consider. Now, in terms of long-term side effects, we really haven't seen any. There is a possibility, but we really haven't seen a lot of them. Like if you went in there and you had a treatment with somebody who's really responsible, really looking out for it, and you had one of these terrible side effects and they didn't do anything to mitigate it, then yeah, you could have long-term sequelae. But otherwise, it's a rather safe process, especially if you're using your own cells.
So when a person has done stem cell therapy, does he require to maintain any kind of diet and lifestyle protocols to see the effectiveness of stem cell therapy last longer?
Of course. But, and this is a very important but, the one thing that I want to make very clear is that they have to do that not because of the stem cells. They have to do that because they want to take care of their health. Remember that stem cell therapy is not something that we do instead of everything else that we're supposed to be doing to care for ourselves. It's something that we do in conjunction with, in addition to everything else that we're doing. So you don't suddenly get stem cell therapy and then say, now I can go to McDonald's whenever I want. You don't get stem cell therapy and say, now I don't need to work out. You don't get stem cell therapy and say, I no longer need to watch out for my sleep hygiene. You do it because you want to heal your body. And in order for your body to heal, you need to stop hurting it. And if you don't watch out your diet, you're hurting it. If you don't sleep well, you're hurting it. If you don't exercise and move a little bit, you're hurting it. So that's the one thing I always like to emphasize. Do you have to have a specific routine afterwards in terms of lifestyle and nutrition and whatnot? Yes, you do, but not because you had stem cells. You need to do that because you need to stop working against your body.
Right. So like they say that you have to always take care of your health with proper lifestyle. It's irrespective of whether you've done a treatment or not. You have to take care of yourself.
And whether you have MS or not.
Yes.
So these are recommendations that I would give anyone.
How long does the results last?
Okay. Again, that's very variable. Remember that we consider a successful treatment one in which, number one, you obviously don't have any important side effects. And number two, a patient with multiple sclerosis does not deteriorate for a certain period of time, usually 6 to 12 months. 6 months because it's the standard that a neurologist will give you. That we tend to use the same kind of like measuring stick. However, we've seen that most of the results last a little bit longer. So 10, 12 months is not uncommon for patients to come in at a certain clinical level, and 12 months later, they're at the same level. And people might say, well, I'm stuck at the same level. Yes, you're not worse, which is what the standard medical establishment was giving you. So that's standard. Have we seen reversal of symptoms and improvement in terms of coordination, strength, mobility, energy levels, pain? Yes, we have. However, it is very important to gauge expectations. That is not the goal of the treatment. The goal of the treatment is to prevent further deterioration in the short to midterm. So 6 to 12 months, sometimes last 18 months, sometimes it is 24 months. There are so many different variables in play here. So that is what the main goal is, to try to stay at the same clinical level within 6 to 12 months, which is what normally a lot of patients want to know. They say, should I do it now or should I wait? Because I don't have a lot of symptoms. Well, you know what? If you can allow yourself, and if you can fund the investment, if you can get yourself into a clinical trial, do it sooner rather than later, because then you're going to be able to stay at this level instead of waiting until you're at this level so that you can maintain this one.
This treatment of stem cell therapy, why people are reluctant to use it? Because of the expensive treatment that they say. Would you like to tell a little about that as well? How expensive is this currently, and do you think in future the expense might go a little down?
I do think that we will eventually start seeing some forms of safe stem cell treatments for certain conditions become less expensive. I don't think they're ever going to get to like basement prices. I don't see a scenario where insurance is going to be covering any of these treatments anytime soon. Maybe 5-10 years down the road, that might start happening in some. I do know that there are some progressive governments with some progressive public health systems, especially here in Europe and certain areas, where they will provide stem cell treatments for their citizens when needed in certain conditions, right? So now that, having said that, if somebody said, well, you know what, I live in the US, so this is probably not going to happen to me anytime soon. What are we talking about in terms of investment? Well, in terms of investment for a treatment, a proper treatment with stem cells, cultured and expanded. Number one, you cannot do that in the US. You cannot do that in a lot of countries in Europe. Cultured, expanded, and reutilized, you will need to be looking to going out of the country. So what are the most common destinations for these type of treatments? Well, if you're in America, you're talking Mexico, you're talking certain places in Central America. So Panama, Costa Rica had them for a while, and then they kicked some of those clinics out. Now they're in Panama. Dominican Republic, I believe as well. Russia had them, or has still one or two centers. I know that India has a couple of centers. Now you need to figure out where they can, like I said, your condition, just like with most other autoimmune disorders, is very specific. You need to look for a very specific kind of treatment. And you need a facility that will be able to culture and expand cells so that you can get your own cultured and expanded cells. And they don't want to sell you, umbilical cord blood and then all the wonders of it. And when they do that, it basically means this is the only source of cells that we have access to, or we don't have a license to culture and expand. And they're probably not the best facility for multiple sclerosis. They might be for other conditions, but not for multiple sclerosis. So considering those things, ballpark figures, you're talking around $17,000 US, plus your travel expenses. Sometimes a little bit higher, up to 25,000 is kind of like the common ones. But there are certain facilities where their protocols, they charge $50,000, $55,000, $60,000 because they do myeloablation and they have you there for 30 days and they do all sorts of things, which might be indicated in some patients. But the bulk of patients with multiple sclerosis who might be suitable candidates for a therapy, ballpark figures that you can expect to pay is anywhere from 17 to 20.
That's wonderful. Thank you so much.
Right one. And if you would like to speak to me about these things, just head on over to my website, drernestomd.com /stem cells, and book a call with me, a brief call with me. And I can help you figure it out and maybe, refer you to a facility that can serve you.
Well, thank you so much again, Doctor, for your time, and have a wonderful day.
Thank you for the invite.
Thank you, warriors, for being with us. I hope you found this session useful. We will be back again next week with another informative session. So, don't forget to subscribe and reserve just 10 minutes for MS.
No, you're not alone.